The next question is like how coronaviruses transmit. I think now we have had established enough that is transmit through droplets, and it can go very far now. I mean, through droplets, through micro droplets, and so on. And the purpose to show you this slide is really to emphasize is not just that it is in the air, but if you're coughing and sneezing in house, then the associated surfaces could also be contaminated. So until you don't clean, those virus would stay in there. But in public gathering, the major emphasis should be on to the breathing, coughing, and the contacts through contaminated surfaces like elevators, door handle, shared off mobile phone, and etc. So understanding these one and keeping these surfaces and these concepts in mind is absolutely important to plan any cleanliness in daily life. So I just want to show you two small videos to give you a scale of the contagiousness of this virus, because this appear to be highly contagious in the nature, because we haven't seen such contagious viruses in the history, and those are the ones that are causing a certain level of mortality as well. For example, if we look onto the influenza virus, if one person infects the next one, and then that person infected infect another 1.2 to 1.3% people, and those are then carrying on passing the infection. So after 5 cycles, only 45 people can be infected. But when it comes to the coronaviruses, because of their infectious nature, at least 2 to 3 people can be infected. So in 5 cycles of the same cycle as, for example, in comparison to influenza, more than 350 people can be infected. So you can see the scale of this infection. And probably that was the reason that it took the world by storm, and it's spread so much that within 3.5 months, we have over 1 million people infected. And these 1 million people are those are confirmed cases. There are a lot more, those are not tested. For example, even in the UK, only people who are showing severe clinical sign, they are hospitalized. These are those are tested. Not everyone in the population is tested. So if we test everyone, the scale would be even more higher. But that also really remind us that social distancing and staying home is absolutely important, because if you don't do so, the number of cases would carry on increasing, as you can see from this animated small video, that the expansion of this scale. So if you are not practicing any social distancing, carry on vertically and carry on increasing significantly. But if you implement social distancing, so you will see a massive decrease into the number of cases on a daily basis. And this is starting from limited number of people. And if it is practiced on a country scale, you can imagine the impact it would have.